Hello, everybody. I'm Dr. AM Thirugnanam, Senior Interventional Cardiologist from Ipcard Cardiac Care Center. Today, I'm going to talk about coronary angiography related complications. How you are managing these procedure related complications during and after angiography. You could have seen live coronary angiography video in my Ipcard Cardiac Care Center YouTube channel, where I give clear information how we are performing the procedures and what are the injection drugs, pre-preparation and post-procedure care, how we are taking care. Very elaborately, I give that video, live angiography. Here today, angiography-related complications. Even one unwanted, like unexpected complication that has become more prominently spoken in public because patient, lot of patients even nowadays have even restrictions, fear, and myth about coronary angiography. They could have heard, or they might have heard the information of patient to somewhere before during angiography could have been died, or some other complications, major complications. So based on that previous experience from their friends and relatives, so even still today, a lot of people are hesitant to undergo coronary angiography, invasive angiography, because this coronary angiography is a very safe procedure and it's a life-saving procedure. One must understand it's a life-saving procedure. Diagnostic purpose, very limited way we perform angiography. For simple to rule out any diagnostic or suspected coronary artery disease, it is not necessary to undergo invasive angiography. For that, we have CT angiography. That's a matter of like a 10 minutes, 15 minutes procedure. Even this invasive coronary angiography, it takes 15 to 20 minutes only. Very specifically, I'm going to talk about simple complication to major complications. If you take the overall complication of coronary angiography, the patients undergoing coronary angiography, overall the global risk burden complication is less than 1.7% only. That means it may be a mild to moderate or severe complications based on the patient comorbidities. Here, I have classified into three groups angiography related complications. The first one is puncture site complication. Second is device related. Device related means the catheter and sheath wire which we are using during coronary angiography. And very importantly, one more contrast agent. These agent related complications comes under device related. Then patient comorbidities. Number three, comorbidities in the sense the patient is having uncontrolled diabetes or uncontrolled hypertension, if they have a congestive heart failure or severe pulmonary hypertension, severe mitral regurgitation, severe aortic regurgitation, or if they have severe aortic stenosis or mitral stenosis, if they have severe pulmonary capillary wedge pressure, if it is more than 20 millimeter mercury, these patients comes under high risk for coronary angiography. Even severe chronic kidney disease, stage 3 to stage 4. And sometimes patients, those who are having stage 5 kidney failure, those patients comes under very high risk. Here, before taking for your information, before taking the patient for coronary angiography, we thoroughly evaluate the patient risk. And what are the complications we are going to face? We anticipate before. So the procedure is very safe. Why I am insisting again and again means this procedure is very safe. Patients who are having high risk, suppose the angiography is going to patient improve the patient life expectancy, or if you improve the patient, those who are in critically ill in ICCU, definitely will perform the procedure under maximum observation with advanced skills. Let's see the puncture site complication, general complications, the puncture site complications, I'll tell you. In puncture site, actually we do angiography in major four vessels. Firstly, we prefer right hand radial artery. Right hand radial artery. The same way, right leg femoral artery angiography. If the right hand radial artery is not good, is not palpable healthy, then we prefer left hand radial artery. Suppose if the left hand radial artery is not good and healthy, we go with left leg femoral artery. These four major artery segments are very important for angiography or catheter related procedure, percutaneous coronary interventions. In rare situation, in like unavoidable complications and very elective and life-saving procedure, we select brachial artery, both the hands brachial artery. But diagnostic angiography, these four vessels, right radial artery, left radial artery, right femoral artery, and left femoral artery, very commonly used arterial route to perform angiography or angioplasty. The puncture site related complications, sometimes the puncture, repeated puncture, can cause inflammation, can cause sepsis, can cause hematoma at the puncture site level. This is very minor complication. Even after the discharge, these complications, like a little mild complication, even after the procedure 2 to 3 days, that will subside. Suppose in case of right femoral artery or left femoral artery, suppose like it may happen because intentionally no doctor, no cardiologist will harm the patient, because sometimes obese patient, sometimes abnormal anatomy, distorted anatomy during the puncture, femoral artery puncture, the puncture needle may go into abdomen wall, it may go into peritoneal cavity. Sometimes it may get punctured. That type of situation, patient may develop bleeding or abdominal bleeding, injury, sepsis. Sometimes even vascular flow also will get stopped. But the experienced, skilled, and very trained cardiologist, they will take care of it complication very simply, and they treat it very simply. There won't be any fear of life. So this is a very simple related puncture site complication. If we take the device related complications, in the sense like while engaging the catheter, the wire, especially in the radial artery, left or right radial artery, left arm or right arm radial artery, the catheter or wire, the radial artery size is less than 3 millimeter. In that small vessel size, during like engaging the wire or catheter, there may be a spasm or mild dissection or maybe a major dissection without knowing. Sometimes the wire which we are passing through the catheter for angiography, the wire also can cause dissection or it injure the vessel wall. That device related complications, immediately will come to know the patient may feel sudden leg pain or arm pain, wherever whatever the vascular site we prefer, there they may feel little pain. But immediately all the consultant, they'll get alerted. They get alerted and they look into the area, the reason for the pain, and they'll try to clear it. So no need to fear. Again, why I'm telling means this is a very safe procedure. So the dissection, perforation, or hematoma, that can cause like sometimes a major hematomas are very limited, particularly in a diagnostic angiography. I'm talking about only diagnostic angiography. Other procedures also like angioplasty. This related procedure is very small, and moreover, this procedure consists of very small sized like catheter and wire, like a 6 French catheter, like 3.5 mm or 4 mm, within 5 mm diameter related devices we are using during coronary angiography and angioplasty. In rare situation, if the patient need blood pressure support, like a hemodynamic support, IABP, intra-aortic balloon pulsation, and the impeller device to support the left ventricle. When the left ventricle fails, but to undergo, the patient may need urgent angioplasty. In that situation, we use IABP, balloon, and impeller device. That device is almost little large bore devices. For that, we take always pre-precaution, and accordingly we arrange the materials in concerned about patient safety. Always we look into the patient safety first priority, any devices. So no need to worry about the device. So device related complications are very timid, like a perforation. Suppose if the operator is taking a left radial angiography or right radial angiography or angioplasty, even during after the procedure, during retrieving and engaging the materials, patient may get mild perforation in the radial artery, and followed by consequently patient may develop compartmental syndrome like inflammation and swelling and hematoma in the puncture site. Sometimes, very rarely, I have come across one patient. I didn't see from my colleague. I saw the patient developed arterial aneurysm, radial artery aneurysm after performing angiography. That's something like missed unknowingly. That unfortunately that incident happened. But in that situation, we need to take care of the patient's safety. Okay, no doctor will allow the patient to suffer. So before the discharge, all the cardiologists will take care of that complaint or procedure-related mild or moderate complications. Before the discharge, they make the patient perfect, fit to get discharged. So these device-related complications are very easily manageable and more very rarely happens. This type complication, even I can say like 1 in 50,000 patients or 1 in 1 lakh patients, rarely happens. If you see the next comorbidities, patient comorbidities, like the patient is having like uncontrolled diabetes. Suppose if the diabetes is more than 350 random blood sugar or more than 300, if it is difficult to control, but better it is not advisable not to take the patient for angiography. Before that, we have to bring the diabetes under control. Suppose if the patient is having hypertension, first we have to treat the hypertension first. At least we have to bring down the blood pressure, systolic blood pressure below 150. If the pressure is below 150, safely we can take the patient for angiography. Suppose in acute CVA, acute cerebrovascular events, but in acute cerebrovascular events, within 3 hours, if we take the patient for angiography to treat the cerebrovascular events or disease, it is safe. But for in acute emergency cases, to bring down the blood pressure, we will not wait for the patient. To save the patient life, we give IV antihypertensive drugs, particularly labetalol, IV enalapril. These type of two important drugs. Suppose IV like nitroglycerin, we give some very important drugs to improve the hypertension, to bring the blood pressure under control. So before taking the angiography, if the patient diabetes and hypertension is not under control, first we stabilize the patient, then later we take the patient for angiography. If the patient is having heart failure, if ejection fraction, pumping function is less than 30%, in acute MI, the patient is admitted in ICCU, critical care unit. The patient is having ongoing ischemia or recurrent hypotension, shock. In that situation, we will not wait to stabilize the patient. We have to take the patient for angiography followed by angioplasty to save the patient life. That is not the elective procedure. That is very important life-saving procedure. In elective procedure, we can take all the risk factors and we stabilize all the risk factors before taking for angiography. In an emergency situation, it is not necessary to wait for the patient to stabilize all the risk factors. Very particularly, importantly, if the procedure, the doctor concerned consultant cardiologist will decide the patient's safety. Because the procedure is going to save the patient life, he will take the patient for angiography, for angioplasty, followed by angioplasty. Suppose if the procedure, we will estimate the prognosis. If the patient is going to get benefit for by that like invasive procedure, definitely he would perform the procedure. He would perform angiography and angioplasty. Suppose in critically multiple organ failure, generally nobody wish to take the patient for angiography or angioplasty in multiple organ failure. Multiple organ failure means like congestive heart failure, lungs failure, kidney failure, liver failure, and patient with cerebrovascular events. In that condition, it is impossible, it is unadvisable to take patient for any invasive procedure. There, first to gradually, as maximum possible, we have to try to save the patient life, to save the patient organs. The procedure definitely, and 90% not going to give any patient any benefit. So that is the reason in multiple organ failure condition, we don't perform angiography or angioplasty. Other than like a stable patient with risk factors or immediately modify risk factors, we try to correct the risk factors. In case of kidney failure, like chronic kidney failure, we take maximum precaution. Chronic kidney failure, because the creatinine is more than 1.5 persistently for a long time, or 2, 3, 3.5. The patient is stable. The patient can undergo angiogram safely. And we have some important medications to save the kidney during angiography or post-angiography contrast exposure. So by this way, we take all the important precautions to save the patient life. Because some situation, naturally, the patient is having very high risk. As I said, severe congestive heart failure, ejection fraction will be less than 35%. Patient will have hypertension and severe triple vessel disease, left main coronary artery disease, and congestive heart failure, as I said before, class 4, severe pulmonary hypertension, severe aortic registration, severe mitral registration. Those type of comorbid conditions carries high risk during procedure. Patient may develop ventricular arrhythmia, ventricular tachycardia, ventricular fibrillation. But we always prepare. We keep all the important, like emergency staff by stand. We keep defibrillator. If the patient develop ventricular tachycardia, ventricular fibrillation, cardiac arrest, we keep CPR team and the defibrillation ready on the table. And we keep anesthetist by stand. So we keep all the emergency team while performing high-risk coronary angiography or angioplasty. So no need to panic. All the precautions to save the patient life, to ensure the patient's safety, discharge. We use all the techniques, all the skills, advanced skills to save the patient life. Okay, friends, any doubt? Any doubt regarding coronary angiography? You can write down the comment box and subscribe this channel. So don't panic to undergo angiography, elective or important angiography. Very special situation, we do not perform angiography or angioplasty because the patient is going to get benefit from the procedure, we would perform the procedure, or else we don't perform the procedure, we will abandon the procedure because of patient safety and economically. So take care of you. And in this pandemic situation, keep it in mind, everyone should take full dose of vaccine and always wear face mask while coming out and try to avoid unnecessary travel. Maximum possible, get rid of social gatherings. And the next video, I'm going to talk about what are the indications, what are the necessary situation, what are the diagnostic criteria, what type of people should undergo angiogram, and what type of people, what type of category, what type of disease patient not necessary to undergo angiogram. The next video will follow you. Until then, bye bye. Thank you. Take care.